MontgomeryPT.com with our video on glute strengthening for runners. I'll go ahead and throw my quick disclaimer in here. This video is intended for information only. While I am a licensed doctor of physical therapy, I'm not your physical therapist, and so this video is not intended to diagnose, treat, prevent, or cure any injury or illness, nor does it guarantee any specific outcomes regarding health, fitness, or running performance. I highly recommend that you consult with your healthcare provider prior to starting any new exercise to make sure it is appropriate for you. Okay, so now to the butt of the matter. So there's three glute muscles, the big one, the medium one, and the little one. Literally, in Latin, their names are gluteus maximus, gluteus medius, and gluteus minimus. We tend to call them glute max, glute med, and glute men for short. So the glute med and glute men both start from the top side of your pelvis, run down and attach to the outside of your thigh bone. Glute max starts from the upper back of your pelvis, across the SI joint, down the side of your sacrum, and then wraps around and attaches on the back top outside of your thigh. So the glute med and glute men do, when they activate, they do the motion of hip abduction. They also, when you're in single leg stance, prevent your pelvis from dropping down. So they elevate the pelvis as well as abduct the leg. So in walking, running, single leg stance, they're primarily active isometrically to just not allow any dipping of the pelvis. So you'll notice if you see someone walking and they've got kind of a drop every time they step on one leg, or they've got a lean of their trunk over every time they step on that leg, they've probably got some issues with their glute med, glute men. It's not working to stabilize the pelvis, keep the trunk upright when they're on that leg. Glute max primarily does hip extension and also does hip external rotation. It's primarily active in running just before the foot hits the ground and then through that loading response. So as you are landing and you're sinking down into hip flexion, it's active to control that sinking down and to store energy in its tendon, which then helps with push off at the end of stance phase. It also works to, as you're going through that landing phase, to prevent the knee from rolling in more than it should. So it works to stabilize the knee and control that collapse into hip flexion during landing. So there have been a lot of studies done that show correlation between weakness in the glute muscles and common running injuries like IT band syndrome, patellofemoral pain or anterior knee pain, lower extremity stress fractures, and maybe even some Achilles tendinopathy, plantar fasciitis issues. There's a bit of difficulty though, because most of the studies done have been retrospective studies, which are looking back. So they take a sample of athletes, some that are injured, some that are not. They measure a bunch of things and say, oh, the group of injured athletes are weaker in their glutes than the group of not injured athletes. Versus prospective studies, which start with a group of athletes, measure a bunch of things, and then look at them through the season and say, okay, at the end of the season, is there any relationship between the athletes who were weaker in their glutes and those who became injured versus the athletes who were strong in their glutes and those who did not become injured. So the problem with the retrospective studies is they leave a bit of a gray area on, did the glute weakness contribute to the injury, or did the injury change the way that that athlete moved and used their legs and then contribute to disuse of the glutes and therefore weakness of the glutes. And it's kind of hard to tell. So another topic that's been looked at is glute activation and movement patterns during running versus just straight up glute strength. And so there have been some studies that have showed you can strengthen up the glutes. If they're weak in an injured or non-injured runner, you can strengthen those up and not have any effect on the way that person moves when they run. So if you're looking at things like, does the pelvis drop on the opposite side? Does that knee cave in, roll in more than it should? Which are known to be risk factors for IT band syndrome and anterior knee pain or patellofemoral syndrome. If you take that person and you strengthen up their glutes a bunch so that they can hold their knee in the right position and hold their pelvis level, that may not necessarily change the way they run. So what I want to do today is show you 2 exercises for the glute me, glute men, 2 exercises for glute max, 1 exercise that kind of combines the 2 and starts working towards, okay, movement pattern wise, how can you control funky movements when you run? And then also just give you a few cues that have been used in some of the studies and also with clinicians to help retrain gait mechanics if you feel like that's something that you're having trouble with. So let's start with glute me, glute men. The exercises here are going to be a hip abduction movement and then an isometric hold. So if we start with the hip abduction movements, you can either do them lying down or standing. So I'll show you both ways. Lying down would be on your side. You want your bottom knee can be bent. You want your top leg straight. You want your hips to stay what we call stacked. So vertical, playing down through your hips versus letting that hip roll open. You do not want this. You want to keep that hip rolled forwards here. The movement is to swing your leg up towards the ceiling, but also slightly backwards, and keep your foot pointing straight forward or horizontal parallel with the floor. So the ways people cheat with this one is they either roll the hip backwards or they roll the foot upwards and kick to the front. What that does is that changes which muscle you're using. So instead of using the glutes to do that movement, you use your tensor fasciae lata muscle and some of your hip flexors, and that's not what we're working on. So you want to keep the foot parallel with the floor, pelvis vertical, swing that leg up and slightly back. It makes for a smaller movement, but it's going to target the right muscles. You should be able to do 30 of these pretty easy if you're a runner without losing your form. So that's kind of a good benchmark to go by. Alternately, you can do them standing. I prefer to have people do them with their back against a wall because what you're going to want to do is put your heel against the wall, get your hips level, your pelvis level, and then you're going to lift that leg out to the side and back down, making sure your toes pointing and kneecap are pointing straight ahead the whole time. So again, people tend to cheat on this one by either hiking the hip up and leaning their body or letting the leg come off the wall and point toes up. So it's not a big movement, but keeping your foot and leg against the wall is going to help make sure it's the right movement to target the right muscle. The other exercise that I like to do for glute me, glute men is something I call the flamingo. So for this one, you need a wall again as well. You're going to stand one side to the wall. Going to be standing on your opposite leg, so the leg away from the wall is going to be your single leg, standing leg. Leg against the wall is going to be bent 90 degrees at the knee, in the same plane, so the thighs should be in the same plane, not up in front like this. Keep it in the same plane. And then you're going to put your knee and foot against the wall. And you're just going to try to stand tall. Make sure that standing knee isn't dropping in. So try to stand tall. Rotate that standing knee slightly out. Push into the wall with the wall side knee and foot. And this one starts to burn pretty quickly. So from the front, if the wall was over here, it would look like that position that I'm trying to hold. So usually with this one, I'll do holds for about 10 seconds. You want to build up to about 6 per side, so it's a minute total. I like that exercise because it's isometric. So it's working the glute me, glute men the way that they're working when we're walking, when we're running. They're not usually active either eccentrically controlling a hip drop, and they're not usually active concentrically lifting a hip up. They're usually active isometrically, trying to keep everything still and in that frontal plane as you're walking, running, standing. All right, so glute max exercises. I'm going to start with one that's really good for you to kind of assess your own glute strength, and then a second one that's more for assessing and working on glute activation. So the first one is a basic bridge that I'm going to show you. Pardon the way that I get on the floor right now, it's a little awkward. But you want to start laying on your back, feet flat on the floor, hands up towards the ceiling. And the first movement here is just to lift your hips up off the ground into a traditional bridge position. And right here, right away, what you want to notice is, where do you feel muscles working? Is it primarily in your hamstrings, getting a hamstring cramp? Is it mostly in the butt cheeks? Is it tightness up in the lower back? So one tip here would be practicing squeezing your butt tight first. So I will sometimes tell people this is the $100 bill exercise. And if I put a $100 bill between your butt cheeks, you drop it, you lose it. Squeeze your butt cheeks tight to hold that $100 bill. Keep them squeezed the whole time you're lifting your hips up. That's going to help keep the hamstrings from taking over, really work the glutes, avoid that hamstring cramp and the lower back tightness. So from here, what you want to do is try to shift your weight over onto one foot and see if you can straighten out one leg. Bring it back in and try the other leg. What you're looking for here is, can you keep that nice straight line through the hip, or does that hip drop down as soon as you try to pick the foot up? So ideally everything stays nice and level as you go back and forth, but what we tend to see is a dropping down, and that's a little exaggerated, but I've seen it that bad, dropping down of the hip as you try to pick the foot up. So again, it's all about squeezing the butt cheeks tight. Another thing that can help is, you'll notice that I kind of lift my toes up off the mat. So if you think about digging in with your heels, that can actually help use the glutes and the quads more and the hamstrings less. So that's another good way to avoid the hamstring cramp and the hamstrings kicking in and taking over. So progressions here would be to start with double leg, just going up and down until you feel like you've got that glute activation right off the bat. Then hold at the top, 10-second hold. And then once you feel like you can do that about 10 times, either going up and doing the kind of little march back and forth, or keeping one leg out and doing single leg up and down. I usually aim for about 20 at a time. And I usually do the single leg ones and I'll alternate. Some days I feel more like doing the marching. Some days I feel more like keeping one leg and just going up and down. Whatever makes you happy. Just make sure your form is good. The other glute max one that I want to show you, ideally you would use the back of a couch or a counter or a table, something stable. I'm going to show you using the foam roller, which is not stable. I don't recommend using a foam roller for this at home. But you're going to lean forwards on your forearms onto whatever surface you're using. Put your legs into a nice, big, deep lunge, and then tuck your back toe under. So there's really not much weight on your back foot. 95% of your weight is on your front foot. Front knee is bent. You're going to squeeze your quad muscle to straighten your back knee out. Squeeze your glute muscle to just barely pick that toe up off the floor and put it back down. So with this one, what we're working on is dissociating movements of the hip extension, from the pelvis. What people tend to do is arch their back, use their back muscles, and move the whole pelvis as well as the leg, or kind of open up the hip on that side, which defeat the purpose of turning on that glute max muscle. So make sure the pelvis stays level, back shouldn't move, back should be relaxed because you're leaning forwards on a stable surface. Just squeeze the quad to straighten the knee, squeeze the glute to barely lift the toe up, put it back down. Again, I usually aim for about 20 to 30 of these at a time. You'll notice you'll feel more burn on the glute of your standing leg. So this is a nice exercise because you get 2 for 1, where you get strengthening of the glute on the standing, the front leg. You also get to work activation of the glute on the opposite side. So you get 2 for the price of 1. So the combo exercise I want to show you, I've shown you before. It was for the quad strengthening knee control video. It's the single leg squat. And so for this one, basically you're going to be standing on one leg and just going into a little mini squat up and down. So what you're working on here is really working on that knee control. So trying to avoid letting that knee roll in too far. Also paying attention to your hips, avoiding that opposite hip dropping down, letting the knees touch. So keep hips level, knee pointed straight ahead, and just make sure you've got good squat form. So sitting back into your hips, not coming just forwards into your knee. So think, stick the butt out, pelvis stays level, knee stays pointed straight ahead. Once you get comfortable with that little movement, you can make it deeper to make it harder. You can also make it harder by doing different direction squats. So I'll usually do a 3-way where I aim forwards the first one, sideways the second one, and then backwards the third one. Kind of a balance lunge combo. Or progress to single leg hopping, where you're going to do a little squat, little hop. Squat, hop. That's just going to help work on that movement pattern, work on glute activation, glute usage during the landing phase, which may help translate better into running form versus just doing hip extensions and bridges. All right, so the last thing then is just little tidbits for running technique. Some of the cues that I've seen used in studies as well as in the clinic are cues to think about keeping your pelvis level while you run. So trying to almost let your pelvis and your trunk float along while your legs are turning underneath. That's a fairly good way to work on avoiding pelvic instability in the frontal plane, where your hips kind of dropping down. Think about really keeping those pelvis level. If you're on a flat stretch of road or a treadmill low speed and you're just jogging really slowly, you can even put your hands on your hips and see if you feel any shifting around there, and just work on trying to keep that nice and tight. Another cue that gets used a lot is thinking about your kneecaps, trying to point your kneecaps either straight ahead or slightly out, or even thinking about if your knees are flashlights and there's beams of light coming out of your kneecaps, trying to make those light beams point straight down the road, not letting them kind of roll and cross over and move too much when you're running. Those are the main ones that get used. So as usual, references will be underneath this video, and then you can head over to the website www.runhappierpt.com to check out blogs and other information, and shoot me an email if you have any questions, comments, or think that this might be an issue that you'd like to work on. Always, of course, talk to your running coach, your PT, see if they can help you out with it as well. But I'm available to chat through the website or also on our Facebook or Instagram pages. So thanks for watching.